Me and Kayla decided to do our project over Alzheimer's disease because once thought as rare, it is actually the most common form of dementia. We have a chart, and it's the current and projected numbers for the people around the world with Alzheimer's disease. Today, they're projected about 35 million people with Alzheimer's disease. It's estimated that by 2030, that 65 million people will have Alzheimer's disease. And around 2050, 115 million people will have Alzheimer's disease. Alzheimer's disease can be described as an irreversible disease. It progressively destroys one's memory and thinking skills, and it was first discovered by a German physician named Dr. Alois Alzheimer. Currently, 5.3 million people in the United States alone have Alzheimer's disease, but the number is expected to increase by 300% over the next 40 years because the oldest age categories make up an increasingly large percentage of the population. Alzheimer's disease, or it's known as AD for short, may occur as early as the age of 40, but the initial onset, it's most commonly seen at the age of 60 or between 60 and 65. Changes in the brain begin at least 2 decades before the estimated onset of clinical symptoms. So you can actually have things going on with your brain, your body, but you're not officially diagnosed, or you may not know you have it. Scientists do not fully understand what causes Alzheimer's, although they believe that it is clear that it develops because of a complex series of events that take place in the brain over a long period of time. So they know it affects your brain, obviously, but they don't actually know the cause. Typically, Alzheimer's disease has been divided into early onset and late onset. Early onset, which is short for EOAD, is before the age of 60, and late onset, which is abbreviated LOAD, is onset at or after the age of 60 years old. Late onset occurs in most patients, and that is 95% of patients have late onset, and early onset accounts for a small portion, which is around 5%, less than 5. Approximately 10% of people older than the age of 65 have Alzheimer's, and about 50% of those older adults older than 85 have Alzheimer's also. The first actual diagnosis occurred in 1906 when Dr. Alzheimer noticed changes in the brain tissue of a woman who had died of an unusual mental illness. Her symptoms included memory loss, language problems, and unpredictable behavior. Today, the diagnosis of sporadic Alzheimer's disease is based on relatively vague clinical criteria. Diagnosis is definite only with an autopsy examination, so you can't officially be diagnosed with Alzheimer's until basically after you're dead, because they have to do an autopsy of your brain. They can diagnose you with it, with symptoms, but it's basically not officially until after you've died. 2 other risk factors associated with Alzheimer's disease are family history of the disease and the APOE genotype. Amyloid plaques and neurofibrillary fibers in the brain are 2 of the main features of Alzheimer's disease. The third feature is a loss of connections between nerve cells in the brain. Over time, they lose their ability to function and communicate with each other, and they eventually die. Here is a picture of a healthy brain or healthy nerve cells, and then Alzheimer's cells and oh my god. Okay, don't stop. Here's a picture of a healthy nerve cell and a Alzheimer's cell. Alzheimer's tissue has fewer nerve cells than a healthy brain does, because, like you said, they lose their connections and they die. So the plaques or abnormal clusters of protein are going to be right here. They're going to be between the nerve cells. The dead and dying nerve cells contain tangles, and that's going to be right here. These little threads, and it's going to be tangles all in the nerve cell, which are made up of twisted strands of another protein. we have a right side is the side of a healthy brain, and the left side is someone with advanced Alzheimer's. What happens is the cortex shrivels up. So the cortex is this gray matter on the outside of the brain, damaging it, which it is involved in the thinking, planning, and remembering. That's also why Alzheimer's patients forget a lot, is because their cortex shrivels. Shrinkage is especially severe in the hippocampus, an area of the cortex that plays a key role in the formation of new memories. That's also why whenever you're diagnosed with Alzheimer's, they most of the time forget family members, they forget friends, stuff like that. The hippocampus on the healthy brain, you could see it's smaller, and on the hippocampus of someone with advanced Alzheimer's, it's widened, it's opened. Ventricles are the fluid-filled spaces within the brain. They grow larger. On the healthy brain, right here, you can see how it's more compact. And then on the ventricles on the advanced Alzheimer's patient, it's going to be widened. It's going to be a lot bigger hole. Pause it.
Okay, the plaques and tangles, which are shown in the blue areas on the brain, tend to spread throughout the cortex in a predictable pattern as Alzheimer's disease progresses. The rate of progression varies greatly, and the people with Alzheimer's live an average of 8 years, but some people may survive up to 20. The course of this disease depends in part on age at the diagnosis and whether the person has other health conditions. And what happens is the plaques and tangles, it starts off right here, and then it spreads and it goes around in a pattern, like form around the temporal lobe. And the earliest stages of Alzheimer's, it changes. The changes may begin 20 years or more before the diagnosis, which is shown in this picture. Mild to moderate Alzheimer's stages generally last from 2 to 10 years, which is shown in this one. And then severe Alzheimer's may last from 1 to 5 years, which is shown in this picture. Okay. Medicinal treatments are currently approved for treating mild to moderate Alzheimer's disease. There are no current treatments for the more advanced stages, though. The cause of Alzheimer's disease is unknown, and it has seemed to have a familiar incident of indication on a strong genetic component, so pretty much it's hereditary, or that's what it's showing to be. In the early stages in elderly people, the symptoms are difficult to distinguish from those of just the normal aging with the forgetting to remember things. And in the later stages of Alzheimer's disease, sometimes it is mistaken for other kinds of dementias and mental disorders. Although Alzheimer's develops differently in each person, the symptoms are normally the same within each person, which is the confusion, irritability, aggression, the different mood swings, and withdrawing from family and society because you don't really remember who they are, or you are thinking that you're in a different place, kind of, or that there's somebody that you thought they were like 20 years ago. Other behavioral disturbances such as agitation and aggressiveness and wandering are also reported and appear in about 60% of patients. And it's really in the advanced stages, so sometimes they wander off and they have no idea where they're at. As well as behavior and psychological symptoms, there is a weight loss, and another very common problem, it increases the risk of infection and skin ulcers, and it decreases the quality of life for the patient. These symptoms are of the main sources of caregiver distress and often lead to institutionalization of the patient. So a lot of Alzheimer's patients are actually, they're either with loved ones that are taking care of them, or they have house people from hospitals, or they're in nursing homes. Women appear to be at a higher risk for developing Alzheimer's disease, only in part due to the increased longevity. Because women with Alzheimer's disease live longer than men with Alzheimer's disease, there is approximately twice as many women than men in the population with this disorder. It has suggested that the decline of estrogen production and postmenopausal women may be associated with the vulnerability of women developing Alzheimer's disease. And as you know, whenever you are going into menopause, your estrogen levels just drop. So that's why. Men, in contrast, have an in-strength supply of estrogen and having the ability to aromatize testosterone into the estrogen in the brain. So that's why they have not that high of a chance of getting it. It's because it seems as if the world has Alzheimer's disease figured out. In reality, there's little to know about how to properly vanquish it. Patients diagnosed with Alzheimer's disease have little or no hope, and medications are basically there to help them cope with the symptoms. Families who have loved ones with Alzheimer's disease have to do their best to cope with the patient, and being there to comfort them reminds them of events and people that are there to love them. That's pretty much the way that they deal with Alzheimer's, is just being there for them. Until new clinical explanations, advanced technology, and better medicine, we won't have any way to eliminate Alzheimer's disease for good. Until then, families and patients will experience the devastating symptoms.